Most men over 50 are silently inflaming their prostate, and they don't even know it. It's not genetics. It's not bad luck. It's everyday habits repeated for years that are quietly leading to enlarged prostates, urinary struggles, and sleepless nights. As a prostate doctor, I've seen the pattern too many times to ignore. You might think frequent urination is just part of getting older. It's not. It's your body warning you. And most men don't listen until it's too late. What if you could break the cycle, avoid chronic urinary retention, and take back control of your nights and your life? In this video, I'll reveal what's really causing your prostate to swell, which early symptoms to never ignore, and what simple changes can stop the inflammation before it's too late. This isn't just advice. It's what I tell my own patients. If you're serious about your health, make sure to follow this channel. New insights every week to help you age stronger, not weaker. The prostate is a small gland about the size of a walnut that sits just below the bladder in men. Its primary role is to produce fluid that nourishes and protects sperm. As men age, particularly after 50, the prostate naturally tends to enlarge. This condition is known as benign prostatic hyperplasia or BPH. Though it's non-cancerous, the changes it brings can significantly affect quality of life. With BPH, the growing prostate begins to press against the urethra, the narrow tube that carries urine out of the body. This pressure makes it harder for the bladder to empty properly. Men often notice they need to urinate more frequently, especially at night. Others experience a weak urine stream or a sensation of incomplete emptying. These symptoms tend to worsen gradually, making early recognition crucial. It's important to understand that BPH doesn't appear suddenly. It develops slowly over years, often without alarming signs at first. Many men attribute early symptoms to just getting older, not realizing that these changes could signal a growing prostate. Left unrest, BPH can lead to bladder damage and urinary retention. Knowing the nature of this condition empowers men to act before complications arise. Prostate health after 50 deserves attention and proactive care. Doctors specializing in men's health emphasize the importance of routine checkups and awareness of symptoms. The goal isn't just to manage discomfort, but to prevent progression. By understanding what BPH is and how it starts, men can take control of their urinary health. This knowledge is the foundation for smarter, healthier choices moving forward. Early symptoms of an enlarged prostate often go unnoticed or are dismissed as minor inconveniences. One of the first signs is a weakened urine stream, where the flow feels slow or interrupted. Men may also feel an increased urgency to urinate, especially when they've just finished. It's not uncommon to feel like the bladder never fully empties. These subtle changes may seem harmless, but they can signal the onset of BPH. Another common sign is nausea, the need to get up multiple times at night to urinate. This disrupts sleep and over time leads to fatigue and lower quality of life. Post-void dribbling, where urine continues to leak after one finishes urinating, is another symptom often brushed off. These signs are not simply part of aging. They are your body trying to warn you. Ignoring these early indicators can allow the condition to progress silently. What starts as mild inconvenience can develop into something that interferes with daily activities. Many men only seek help when symptoms become severe, when urination becomes painful or nearly impossible. But by then, the bladder may already be under stress or even damaged. Understanding and acting on these early prostate symptoms is key to preserving long-term urinary and bladder health. Doctors who specialize in prostate care urge men to pay attention to even mild changes. The earlier BPH is identified, the more effective the treatments. Awareness is the first line of defense in protecting your prostate and avoiding complications. One silent but harmful habit many men develop is regularly holding in urine. Whether due to busy schedules, discomfort with public restrooms, or simply not prioritizing the urge, delaying urination puts stress on the bladder and prostate. Over time, this habit forces the bladder muscles to work harder than they should. What seems like a harmless delay can actually trigger a cascade of issues. When urine is held for too long, it increases internal bladder pressure. This pressure not only causes discomfort, but can irritate the prostate, especially if it's already enlarged. The result is inflammation that may worsen prostate symptoms. The longer urine sits in the bladder, the more concentrated it becomes, and that can contribute to urinary tract infections as well. Men with BPH are particularly vulnerable to the effects of delayed urination. Their narrowed urethra already makes emptying the bladder more difficult. Add frequent urine retention to the mix and the bladder begins to weaken and lose elasticity. Eventually, it struggles to empty fully even when given the chance. This sets the stage for chronic retention. Prostate doctors strongly advise against this habit, especially for seniors. Listening to your body and urinating when the urge rises is a simple yet powerful preventive act. It keeps urinary flow consistent and reduces irritation to both the bladder and prostate. Maintaining this habit supports long-term bladder health and helps avoid painful complications later on. When the prostate enlarges and narrows the urethra, the bladder must compensate by working harder to push urine out. This increased effort over time leads to thickening of the bladder wall, particularly the drusen muscle, the primary muscle responsible for urination. This condition is known as detrusor hypertrophy. It's the body's way of adapting to resistance, but it comes at a cost. As the detrusor muscle grows stronger, it also becomes less flexible. That loss of elasticity makes it harder for the bladder to store urine comfortably. Men may begin to experience more frequent urges to urinate, even if the bladder isn't full. In some cases, the muscle becomes so overworked that it starts to contract involuntarily. This can lead to sudden urgency or incontinence. Over time, the thickened muscle may also lose its ability to fully empty the bladder. The result is a cycle of incomplete voiding and increased urinary retention. This not only worsens BPH symptoms, but can also damage the bladder's overall function. It's a classic example of how the body's compensation mechanisms, while initially helpful, can lead to long-term complications. Understanding how the bladder reacts to prostate enlargement is critical for taking timely action. Prostate specialists encourage early intervention to prevent the bladder from reaching this hypertrophic state. With proper treatment and healthy habits, it's possible to maintain bladder strength and flexibility. Protecting the bladder is just as important as treating the prostate itself. Inflammation plays a key role in the progression of benign prostatic hyperplasia. As the prostate becomes irritated, whether from pressure, infection, or retained urine, the immune system responds by sending inflammatory cells to the area. This creates swelling and discomfort. But more importantly, it activates a biochemical chain reaction. These signals can prompt the prostate to grow even further. SIT1s and growth factors are released during this process. These substances, while intended to aid healing, can also stimulate the production of new prostate cells. This is particularly problematic in aging men whose hormonal environment is already primed for prostate enlargement. Inflammation becomes more than a symptom. It becomes a driver of the disease. Chronic inflammation also affects the surrounding tissues, including the bladder, neck, and urethra. This can further restrict urine flow and heighten urinary urgency. Inflammation may be subtle without causing fever or pain, yet it silently contributes to prostate overgrowth. This is why many men with BPH also experience ongoing discomfort or a sense of pelvic pressure. To manage BPH effectively, doctors often focus on reducing this underlying inflammation. Lifestyle changes, targeted supplements, and sometimes medications are used to interrupt the inflammatory cycle. By calming the immune response, it's possible to slow prostate growth and relieve urinary symptoms. Treating inflammation is not just relief. It's a long-term strategy for prostate health. Certain everyday habits often overlooked can quietly worsen prostate enlargement. High caffeine intake is one such culprit. Caffeine irritates the bladder and increases urine production, leading to more frequent urination and urgency. For men with BPH, this added pressure can intensify symptoms and contribute to inflammation. Cutting back on coffee, tea, and sodas can bring noticeable relief. A sedentary lifestyle also poses risks. Lack of movement reduces blood flow to the pelvic area, contributing to fluid retention and inflammation. Over time, this sluggish circulation can affect both bladder and prostate function.